In this procedure, we will cover each critical step in preventing an injury to the nurses and patient while rolling the patient on their side. Once the nurse confirms the patient is aware and understands that the assistance will be provided in the transfer, the nurse must first take note of the current bed position and determine the changes needed to benefit the procedure. The bed should be positioned in the best position to aid the nurse in moving the patient. In this particular transfer, the bed should be flat and raised to the height most beneficial to the nurses performing the move. The bed rails should be lowered. The patient should be lying flat. The patient should cross her arms and rest them on her chest. The nurses should confirm which direction they will be moving the patient before beginning. A nurse on each side of the bed should firmly grasp the support sheet under the patient and on the count of 3, gently lift and slide the patient toward the side of the bed. The nurse closest to the patient should now align the patient's body. The nurse should position her arms under the patient's legs and gently align with the torso. The nurse should now position one arm under the patient's shoulders, being sure to extend the hand to the opposite shoulder in order to have a firm hold. The other hand should be under the patient's lower back. The nurse can now align the shoulder and head with the rest of the body. The nurse closest to the patient may now firmly grasp the support sheet and lift and roll the patient on their side. The nurse on the opposite side of the bed should gently hold the knee and shoulder areas to prevent the patient from rolling too far over. Once the patient is on her side, the top knee should be placed forward with a slight bend and a pillow placed behind the back, slightly wedging it against the patient. Last, place the bed rails in the proper position before leaving.